Well, good afternoon, everyone, and welcome to today's webinar on COVID-19 contact tracing, how it's done, and how you can help. So I'm Rick Rinehart, the Deputy Director at CPWR, the Center for Construction Research and Training. And as many of you already know, CPWR, NIOSH, and OSHA are holding a series of COVID-19 webinars every 2 weeks for the construction industry. And today's webinar is the 5th in the series. You can access recordings from the whole series through a playlist on our YouTube channel, and Jessica Bunting, who you've just heard from, our WebEx host for today, will share that link with everyone in a follow-up email. And Jessica is also online to handle any technical issues and assist as needed. If you're experiencing difficulties with WebEx or with your audio, just message her in the chat box or shoot her an email by responding to the WebEx registration or reminder emails. Should you lose audio at any point, please call in using your phone. The call-in information can be found in your WebEx emails or on this first PowerPoint slide up on your screen right now. So as I mentioned, Jessica is recording all the webinars in this series, including today's, which will be sent to everyone along with the PDF of the slides in a follow-up email after the event. So let's get started. We have a great team of presenters today, and I'd like to thank all of them for being here. We'll hear first from Dr. Scott Earnest. He's the Associate Director for Construction in the Office of Construction Safety and Health at NIOSH. Then Dr. Sara Luckhaupt from NIOSH will describe how public health authorities use case investigation and contact tracing to respond to reportable communicable diseases. And finally, we have Travis Parsons of the Laborers Health and Safety Fund of North America. He will discuss how contact tracing is being used in the construction industry today. And as mentioned just a minute ago, and after our presentations, we will have some time for Q&A. We received a number of questions in advance during registration, and we'll go through those first, followed by any live questions as time allows. If you have a question, please type it in at any time in the Q&A box, and we'll be able to see it. We may not have time to get through all the questions today, and be assured that they're being saved, and we'll use them to help inform topics and information shared in future COVID-19 webinars. So before I turn it over to Scott, I would like to just take a second to remind everyone about the CPWR COVID-19 Construction Clearinghouse, which was launched in May. This is a free online resource that highlights workplace practices, state and local requirements, training resources, and much more. If you have materials, information, or good practices that you believe should be included and shared with others, please send an email to covid19@cpwr.com, and we'll have someone from our staff follow up with you. So with that, I will hand it over to Dr. Earnest to get us started. Thanks, Scott.
Okay, thank you, Rick, and good afternoon, everybody. It's great to be with you again. We continue to work extremely hard to address the hazards of COVID-19 in the construction industry. The flattened curve has begun to spike in the South and West in states such as Florida and Texas, California, and Arizona. Some of these states are reporting record numbers of new cases, and some of them are pausing reopening. We're really at a critical point in our battle against coronavirus. This continues to be a time for caution and for due diligence. And so I wanted to with my update, I just wanted to talk about cloth face coverings, because use of cloth face coverings are so important and we get a lot of questions about them. The first thing I wanted to just mention is that the CDC director, Dr. Redmond, published an article in the Journal of the American Medical Association this week. And the title of that article was Universal Masking to Prevent SARS-CoV-2 Transmission. The Time is Now. And basically what he laid out in this article that he wrote, it was a study that looked at universal masking of healthcare workers and patients to help reduce the transmission of COVID-19 infections in the healthcare setting. This was in the largest healthcare system in Massachusetts with over 75,000 employees. They also were conducting routine symptom screening and testing of symptomatic healthcare workers and patients. And leadership at the hospital required universal masking for all the healthcare workers and for the patients. And when they put this policy into effect, transmission of COVID-19 steadily declined. And so what they found and what's laid out in this article is that a universal masking policy, when it was in place, it significantly reduced positive tests amongst the healthcare workers. There was a steady decline from about 15% to around 11%, or about a 0.5% reduction in cases per day. So that's just one example, but there's a lot of additional work that supports the use of cloth face coverings. This slide shows data from another recent article in CDC's Morbidity and Mortality Weekly Report about cloth face coverings. And in this study, there were 139 clients at a hair salon that were exposed to 2 symptomatic hairstylists that had confirmed COVID-19, but they were not symptomatic. They subsequently did a study of the individuals that were exposed to these folks at the hair salon. Among the 67 clients that were tested for COVID-19, every single one of them tested negative. So they were not, COVID was not transmitted to those 67. The community and company's face covering policy was likely an important factor in mitigating the spread of COVID-19. So the takeaway from this is that as stay-at-home orders continue to be lifted, professional and social interactions can increase the spread of COVID-19, but broad spread implementation of face covering policies can really make a big difference in reducing the spread. And so it's important for all of us to be vigilant and to use cloth face coverings. The next several slides get into guidance available on the CDC website about cloth face coverings, and there's a link at the bottom of this page that you can use to access this. CDC recommends that people wear cloth face coverings in public settings to prevent the spread of COVID. There's a broad consensus in the medical, health, and business communities that masks are critical to curbing the spread of the virus. Face masks are always a way to protect jobs, with studies showing that they are a good alternative to shutting down or locking down as we've gone through over the last several months. And so the outline for this section is shown on the right-hand side. There's information about evidence for the effectiveness, details about who should be wearing them, who should not be wearing them. There's information on this website about use of face shields, surgical masks, and also studies that support use of cloth face coverings. In terms of the effectiveness, there's been a number of studies that show cloth face coverings are effective specifically for respiratory droplets, which is, CDC believes this is the primary mode of transmission. People that are in close contact and large droplets that are expelled when somebody talks or when they cough or sneeze, or even during things such as singing. Wearing a cloth face covering will help protect people around you, including those that are higher risk of severe illness from COVID-19 and workers who frequently come in close contact with other people. Cloth face coverings are most likely to reduce the spread of COVID-19 when they're used widely by people in public settings. Spread of COVID-19 can be prevented when cloth face coverings are used along with preventative measures such as social distancing, frequent hand washing, and cleaning and disinfecting of frequently touched objects. So again, we're talking about a comprehensive approach, but use of cloth face coverings are extremely important. So I want to emphasize that. Who should be wearing them? Anyone 2 years of age and older that's out in the public when you're in close proximity to others. I want to remind folks that COVID can be spread by people that are asymptomatic. That's another important reason why individuals should wear them. Also, the guidance mentions situations where cloth face coverings are not practical. This could include individuals who are deaf, individuals who are disabled, very young children. Also, other situations where people should not wear them include folks that are having difficult breathing or somebody who is incapacitated or unconscious. This slide provides information on wearing a cloth face covering and how to do it. So you wear a cloth face covering to cover your nose and mouth to help protect others in case you're infected. I know I've seen people that are out wearing cloth face coverings, but it's just covering their mouth and their nose is not being covered. You want to cover both the nose and mouth. Wear a cloth face covering in public settings when you're around people who do not live in your household and maintain that 6-foot distance. Wear a cloth face covering to maximize your protection, but also don't put them around your neck or up on your forehead, and don't touch your cloth face covering when you're wearing it. And if you do, make sure that you wash your hands or disinfect your hands after touching the cloth face covering. In terms of the proper way to take off your cloth face covering, untie the strings behind your head or stretch the ear loops that are over your ears. Handle only the ear loops or ties, not the cloth material itself. Fold the outside corners in together. When washing them, place them in a washing machine. You're going to want to use bleach or detergent to help address any contamination on the cloth face covering. And then also, when you're taking it off, be careful not to touch your eyes, your nose, or your mouth, and wash your hands immediately when you're done. Wanted to point out that there's a number of studies that are on this CDC website to support information about the effectiveness of them. So one of them I wanted to mention was a study of an international flight. There were 350 passengers on an international flight between Wuhan, China, and Toronto. They were basically wearing cloth face coverings. There were a couple people that had COVID-19, but it was not transmitted. There's also a study that's cited here about how droplet transmission can occur and how it can be expelled when talking. And they looked at the size of the particles that come out of somebody's mouth when they're talking, and they measured particles in the 20 to 500 micron size. But when the individual was talking and had a face covering on, it virtually eliminated any particles that were being expelled. And then most of the remaining slides relate to cloth face coverings, preventing the spread of transmission. And there's a lot of details in the other studies on variations from one type of cloth face covering to another. It gets into details about fabric types, filter efficiency, and the fact that you can use multiple fabrics or have them folded over multiple times to help improve the collection efficiency of it. So there's a lot of good information in these studies if you want to do a deep dive into any of this. And then just lastly, I wanted to mention the use of face shields. This is an issue that comes up from time to time. Face shields provide some benefit as a source control to protect others from spray of respiratory particles. There's been several studies that have been done at NIOSH on this. The research is very promising. Dr. Lindsley at NIOSH showed a 96% reduction in risk for individuals that are wearing face shields from transmission. And another researcher at NIOSH, Roberge, did a literature review in 2016 that, again, was very positive about the use of face shields. Some people may choose to use a face shield when sustained close contact with other people is expected. Face shields are best used in addition to a mask, not alone, and they should wrap around the sides of the wearer's face and extend down below the chin as much as possible. Disposable face shields should only be worn for single use, and reusable face shields should be cleaned and disinfected each time they're used. And then again, I just want to remind folks that there's a lot of great information, not only on the CDC website, but also on CPWR's COVID-19 Clearinghouse, and also on the OSHA website. And if you want to call and talk to somebody, you can always call the CDC 1-800 number, which is at the bottom of this slide. And with that, I will turn things over to Dr. Sara Luckhaupt, who's going to talk about contact tracing from the NIOSH perspective. Sara?
Okay, thank you. Whoops. I already forgot which way to move the slides. There we go. All right, so thank you for having me here today. I originally was going to have my colleague, Corey Butler, with me too, but she was taking some well-deserved leave, so I told her I would cover today. So I'm going to talk about contact tracing from the NIOSH and CDC perspective here. And we've been talking with a lot of other folks from different parts of CDC to try to understand contact tracing in general and how it fits into a workplace environment. So the first thing to note is that contact tracing is not a new activity that was just invented in the context of COVID-19. But contact tracing, along with case investigation, have been core disease control measures employed by local and state health department personnel for decades for communicable diseases such as tuberculosis and sexually transmitted diseases, and also in the settings of other epidemics or pandemics such as the H1N1 influenza pandemic and Ebola epidemics in Africa. So the two really are seen as going hand in hand, where case investigation means working with a patient who has been diagnosed with an infectious disease, and it involves public health staff working with the patient to help them recall everyone with whom they have had close contact during the time frame while they may have been infectious. And then contact tracing is following up with those people that were named by the case as close contacts and providing support to the people, the contacts, who may have been infected through exposure through close contact with the patient. So like I said, this is not new to public health, but what is new is the volume of cases and contacts that need to be traced. And that's why you may not have heard that much about contact tracing until the current COVID-19 pandemic, because contact tracing has been implemented on such a wider scale, and there have been so many efforts to ramp it up as one of the main measures that can be used to try to help control the transmission. So in the context of COVID-19, we believe that case investigation and contact tracing are essential interventions in a successful multi-pronged response to the disease and the pandemic. And all confirmed symptomatic and asymptomatic and probable COVID-19 patients should receive follow-up to prevent further spread of the virus in the community. And this should be done as quickly as possible, because prompt identification and isolation of patients and quarantine of contacts can effectively break the chain of disease transmission. Just a note on the terms isolation versus quarantine, they both basically mean keeping somebody away from other people, but we use the term isolation when somebody is known or really suspected of being infected with the disease, whether they have symptoms or not. And we just use the term quarantine when it's a person who is exposed but is not known to be affected. So in the context of contact tracing, we would quarantine the exposed contacts, but if a contact is then determined to be a case, then their quarantine turns into isolation. So the authority and responsibility for case investigation and contact tracing are vested in state, tribal, local, and territorial health departments, but especially in the context of COVID-19, with this huge volume of cases and contacts, multi-sector partnerships are essential to scale up the comprehensive case investigation and contact tracing. And this is a URL just to show you that CDC has a whole page of health department contact tracing resources, well, a landing page and then many, many subpages and lots of resources available on the CDC website to help state and local, tribal, and territorial health departments. And they're also good for other organizations, including employers, who are helping out with the contact tracing process. So a note on prioritization, as I mentioned, case and contact follow-up must happen quickly to be successful, because the sooner that you can get a case and a contact who may potentially become a case out of circulation from the general public, then the sooner you can stop the spread, the greater chance you can prevent further cases. So with such a high volume, sometimes there has to be prioritization, and particular consideration should be given to the potential for disease complications among patients with underlying health conditions, potential to expose others at higher risk for severe disease. And you've probably heard that older adults and those with certain underlying conditions are thought to be at higher risk of severe disease. But also cases that have the potential to spread through exposure of numerous people, including in some workplaces, especially high-density critical infrastructure workplaces, and really any high-density settings or congregate working or living settings might need to be prioritized to make sure that the case investigation and contact tracing are done very quickly. And the potential to interrupt critical infrastructure. I already alluded to critical infrastructure a little bit, but that's the reason that some workers are prioritized for contact tracing also. So then cases are referred to isolation, or contacts are referred to quarantine. So healthcare providers have the role of referring to home isolation as soon as possible. Anyone with a symptom-based diagnosis of COVID-19 or a positive viral test. And businesses and workplaces should refer workers to home isolation when identified as symptomatic during a workplace health screening, such as a temperature check or a symptom screen upon entry or exit, or after a positive viral test through a workplace testing program. So health departments can typically perform case investigation and contact tracing for typical communicable diseases with existing staff, and surge staff are rarely needed. But as I mentioned, the COVID-19 response has been unprecedented, and so there can be delays in the health department's ability to do the contact tracing due to large volumes of patients and the quick and easy transmission of this virus, which is really kind of unprecedented too. So for this reason, as you know, employers can prepare and help to limit the spread in the workplace. So we've been thinking about considerations for how that can happen, and the best case scenario is a really close collaboration between the health department and the employer, since the health department has the authority and the responsibility for the contact tracing, but the employer, may have more access to the workers and know more about the close contacts. But we don't think that this collaboration will happen the same way in every case. And so we see at least three things that can happen. When a case is identified that impacts a work environment, the health department may not engage with the employer, especially if it's a small workplace and the worker had few contacts in the workplace. It may be that the health department can follow up with those contacts without engaging the employer. More likely, in a larger workplace, the health department may ask for the employer's help in understanding the work environment and identifying exposures and contacts in the work setting. And there, the role of the employer is really to support the efforts of the health department and help them do the contact tracing more efficiently. But in some cases, especially where there is a good occupational health program within the workplace and there's the capacity for this, the health department may want to rely on the employer to carry out the case investigation and contact tracing of employees in the work environment, in conjunction with the other contact tracing that needs to be done by the health department of the case's contacts outside of the workplace, because that's really not the responsibility of the employer. So there are ways that employers can prepare for case investigation and contact tracing before a case occurs among their workers or before several cases occur. And some things that employers can do include identifying a COVID coordinator or a COVID team to oversee the activities. And hopefully this has already been done with other preparation and prevention activities, but this person can also serve as, person or team can serve as a point of contact for interacting with the health department on contact tracing. If possible, it's good to identify and contact the local health department or visit their website, call them, meet them in person ahead of time before there's a problem so that connections are made and relationships. And create a COVID-19 preparedness response and control plan that includes plans for collaborating on contact tracing along with all of the other preparedness response and control activities. It also could be a good idea to review CDC's case investigation and contact tracing guidance. As I mentioned, there's a lot of information, a lot of resources on the website, and reviewing that can help to prepare to interact with public health. And then it's important for the employers to encourage the employees to work with the health department and to answer the call, as we've been saying, when a contact tracer calls and wants the information to help reduce the transmission of the disease. So after a case occurs, then employers can prepare and quickly provide information and records about the workplace and the activities and the setup of the workplace. about potential workplace contacts, including who's on the same shift or working in the same area of the workplace or the work site, and information about workplace operations to the extent that they don't reveal confidential personnel records or confidential business information. And then it's also important for employers, of course, to respond by supporting employees in any way that they can, and then to follow up quickly by doing workplace hazard evaluation and prevention activities to try to prevent future cases. So one tool that we've recently posted online that might be helpful for employers to work on their COVID-19 prevention, response, and control plan in general, and in preparation for collaborating with health departments, is this interim customizable non-healthcare workplace infection control assessment and response tool. So that's quite a mouthful, so we call it the YCAR. And this is modeled after an ICAR infection control tool that was developed for nursing homes and other healthcare facilities. And then NIOSH realized that some of these principles could be applied to other workplaces. And so we've developed both some tools like this that are specific to certain kinds of workplaces, such as meat and poultry processing, but also this general YCAR tool is meant to be customizable for any kind of workplace or work setting. So we hope that it can be useful in assessing the workplace. So again, collaboration is essential to interrupting the spread of COVID-19 in the workplace, and it's always good to have clear and open discussion of the roles and responsibilities between health departments and employers, and to make sure that all activities conducted are done in accordance with applicable public health authorities and workplace and medical privacy and confidentiality laws. And thank you for the opportunity to present and participate in the discussion today. And again, here's some resources for health departments about contact tracing, but that are also useful to other organizations involved in contact tracing. And of course, the link to the landing page for all of the different guidance for businesses and workplaces.
All right, thanks, Sarah. And hang on one second. Travis, I'm going to hand it over to you.
All right, thank you very much. Can you hear me?
Yep.
Okay. Thank you very much, Rick, Scott, and Sarah. A lot of good information there. And I'm going to try to, some of this might overlap a little bit with some of Sarah's presentation, but it is different because I'm going to hone in on construction and what it's meant on the ground in the construction industry and some of the limitations. You know, us in the construction industry all know that there's a lot of uncertainty going on right now. We have a lot of workers that never stopped working, the essential workforce. We have a lot of workers now that are returning to work. We have differences depending on your geography, what state you're in, and what the protocols are. So there's a lot of uncertainty, especially around contact tracing. Most construction workers and a lot of employers hadn't even heard of the terminology of contact tracing because, as Sarah just talked about, it's traditionally been done by the health departments and agencies all across the country. There's also a lot of technology, people trying to jump on this and help out on the job sites with smartphones and computers, and there's a human aspect to it that needs to be done, and nobody's really sure of what their role is here, and we're figuring it out as we go. On top of that, COVID is obviously a very terrible disease that's going on across our country, and there's a lot of urgency, so we need to keep it simple for both contractors and workers to understand and be able to mobilize quickly on the ground to help with the contact tracing aspects of things. And then one last thing I'd like to mention about the construction industry before I jump into contact tracing specific stuff is I don't think there's a perfect solution. There's no panacea. Construction's very transient nature. There's multi-employer job sites. There's a lot of different contractors on site, a lot of different workforces. There's visitors, there's vendors, you name it. A construction site is very dynamic, which makes contact tracing kind of difficult. But I do think it is a good tool that can be used to help curb the spread of COVID-19. Typically on a construction job site, safety is always paramount in construction. And one of the biggest problems we're finding is we don't know what standards or guidelines to follow. There's no federal OSHA guidelines or standard. There is guidelines by CDC. We don't know if they're enforceable right now. So it's a struggle from one state to another on what guidelines to follow. So in the absence of a holistic and detailed set of federal protocols, contractors will likely need to determine how to protect their work and promote a safe work site regardless. And this is where contact tracing can really come in. A contact tracing tool, such as a lot of stuff that Sara just talked about, helps identify who's at risk and who will empower management to confidentially make decisions to keep the team safe. All right. Let's jump right in here. There's a little picture here that tries to simplify contact tracing. If you go to the CDC website, there's a lot of really good information on contact tracing, but you can get in the weeds really quick, and it gets really hard to understand, and it changes daily, if not hourly, on the CDC website. So our contractors and our employees have been trying to figure this out from the get-go. But just to try to break it down and simplify it, contact tracing in construction is something that's typically performed by public health agencies, and it's a process used to identify, educate, and monitor people who have had close contact with an infected person. These people are at an increased risk of infection and spreading the virus to others, and that's why we're doing it in the first place. And I would like to say the construction's kind of a hybrid of the typical model that Sara just described. It's a combination of working, the contractor, the employees, working with the local health departments, and then letting them do their jobs as professionals. The way the construction industry is seeing it so far is we need to communicate the information across the board to people and keep the lines of communication clear and cooperate, and then let the health professionals do their jobs. Contact tracing is also helps everyone, that's been infected recall who they've had close contact with, and the picture here describes that. It tries to simplify it. You have an infected person that shows either signs or symptoms or has a positive test, and then you look at who they've been in contact with the previous 2 days or 48 hours before symptoms occurred and then after, and then you ask them and alert them their exposure and risk, tell them how to quarantine or isolate themselves, and then also communicate with others. So to further try to simplify things, I've had this pictogram up here. They say this is a concept or a theory I like called boxing it in, or boxing in the virus. So testing widely is very important for this, having people be tested if they are symptomatic, or sometimes they're just being screened and tested before they even go on a job site. So widely testing people. And if they test positive or they're showing symptoms, those people need to be isolated as much as possible and contact the local health departments and figure out how the local health departments can help them, and or quarantine the contacts of those people for 14 days. So this is just a pictogram describing the concept of boxing in the virus. And that goes along the lines of also helping break the chain of infection that Sara mentioned earlier. There's many goals of contact tracing. The main goal is to stop the spread, and to stop the spread, that's to interrupt ongoing transmission of the virus and in turn reducing the spread. This helps by alerting the contacts of the possible infected, also offers preventative counseling or prophylactic care to the people that are patients or workers that are infected or have symptoms, also helps them diagnose and seek counseling or treatment to people that are sick, and then helps them learn about the epidemiology of a disease in a particular population. And anytime you have goals, they should be what they call SMART, specific, measurable, achievable, realistic, and timely. And the reason I put that up there is because when it comes to these goals, we're trying to track this disease and curb the spread. So it's really helpful if it fits those characteristics. I can't stress enough, and I think this is a problem we're facing in construction. And people need to step up and make decisions. Time is of the essence on the job sites. We need to have a process in place, use everything at our disposal, and be timely on the, because with the asymptomatic and pre-symptomatic spread of coronavirus, time is really, really against us right now. So we need to identify contacts and ensure that they do not interact with other critical aspects. It's critical to prevent the spread. Immediately, we need to identify and interview people with COVID-19 disease. We need to support the isolation efforts, warn other people that they've come in contact, and link them to the symptoms and testing. There's a lot of benefits of contact tracing, and that's no different in the construction industry. It's really, it's scary when you do, for people that are symptomatic or get diagnosed, but contact tracing can help them be educated on their symptoms and what to do to help them get through this disease. It helps the contacts separate themselves from other and further spread the disease, and it also helps prevent future disease from spreading. However, there are some limitations, and I mentioned a couple of them with the construction industry on a whole. It's a dynamic situation. This disease in particular, COVID-19, has had both asymptomatic, you've heard that word a lot recently, anywhere from 25 to 50%, depending on the study you look at, of asymptomatic spread, or what they call pre-symptomatic spread. So even people that appear with symptoms after about 5 to 6 days, the first 2, 3, 4 days of exposure, they may not have had symptoms yet. So it's really hard. So that's one of the limitations of contact tracing. But that's also one of the reasons why we need to do it. So again, time is of the essence. It must be done quickly, like I talked about earlier. We cannot hesitate on the job sites. Overnight, if somebody doesn't report it, people could spread real quickly. It could spread to other people real quickly. We also need to think about the potential privacy and confidentiality concerns on the job site. HIPAA and ADA regulations cover those. But, construction sites sometimes are big, sometimes are small. The crews are very close to each other. Everybody knows everybody in a small crew. So we really need to keep this under wraps as much as we can on the job site. This is very important to people's privacy. And it also relies on buy-in from both the employer and the worker. And this is key to it as well. And as you see to the right, I have a diagram here, and you can see the struggle. This is a diagram from a statista on, kind of the likelihood or unlikelihood of people having faith in some of the aspects of contact tracing. And you can see it's all over the board, from CDC, public health officials, to cell phone technologies, companies, and then the federal government. So there's a lot of limitations to contact tracing. Like I said earlier, it is not a panacea, it's not a perfect system, but it does help curb the spread of the virus, and we need to do it. Now let me jump in a little bit on my experience and what I think employers, how they can help assist with contact tracing. Sara talked about a little bit with this. And like I said, in construction, this is a little bit different than your typical scenario. Simply, I think employers just need to cooperate with their local health departments. They need to maintain attendance records of their job sites, including employees' schedules and shifts. That's easier said than done. Sometimes it's a 24-hour operation. Sometimes you have 3, 4 different shifts. You have big and small job sites, and you have multiple contractors. But every employer, every contractor needs to do their best to keep track of all their workers on their work site. And including that, they should also keep track of their visitors and their vendors and their subcontractors. So they must keep control of everyone. That's a big task for some sites. It's a dynamic work environment. But to have contact tracing be done successfully, we must do this. We must take the extra steps to even track workers within specific areas. Maybe you have certain teams or different trades on the job. You should also track those different trades and groups of people, because that's where the outbreaks happen. And also, there's different groups of workers that may work together on different tasks. You might have multiple trades working on a certain task, a certain job operation. So we need to record all this as much as possible with as much detail so we can assist the public health agencies and officials doing their job for contact tracing. All right, what about workers? Just like the employers, workers need to participate. And this is a tough one, because you get into the privacy issues and you get into self-reporting. But we encourage our workers, they have a role in this. They need to report symptoms. They need to report if they've had exposures. Everybody needs to work on this together. And the intention is not to interrogate or pass judgment on any one worker whatsoever. It's to curb the disease and to collect the information to keep everyone safe. All data collected should be kept private and not spread and shown to others, and only used to track COVID-19 cases and monitor risks. It shouldn't be used in any other way. And here's just kind of a pictogram of kind of how the state of Massachusetts, or Commonwealth of Massachusetts, is handling things here. They talk about a confirmed positive test here, and some people are even using symptomatic workers. You know, they go get their care and resource from the healthcare provider, whether it's the public health department or agency, whatever you want to call it. They should be using the technologies at their disposal, at their hands, such as smartphones, computer applications, reaching out to that help, and then they reach out to their contacts and help curb the spread. And in the end, I'd just like to say that we're all in this together to help prevent the spread of COVID-19 and help mitigate the disease or virus when it's on our job site. We need to leave it up to the professionals, and by that I mean the health departments and the agencies. Construction employees and employers need to play their role in this, but it's not their job once they hand it off to the public health agency professional. We need to keep it as simple as possible using the KISS method, and after that, I'm happy to answer any questions or concerns during our question and answer session. Thank you.
Okay, thank you, Travis. And with that, we'll go ahead and just jump into questions. I want to thank the participants and specifically folks that when they registered submitted questions, and we'll start with some of the ones that were submitted in advance. So let's see, the first question is how many days back do you contact trace? And either Dr. Luckhaupt or Travis, either one of you can feel free to jump in. And I think it was covered a little bit during the...
Yeah, I can jump back
Sure, go
in
ahead,
there.
Travis.
Yeah, the CDC recommends 48 hours prior to suspected or known exposure. So 2 days, 48 hours to be more specific.
Okay, thank you. And then sort of another issue related to that, are we still using the 15 minutes and 6 feet to determine close contact?
Yes. Yes, that's the operational definition. If you look on the CDC guidelines website, like I said, you can get lost a little bit really quickly, but that is what we're using. And I think, Scott, that's what NIOSH is using, is the 15 minutes or more exposure within 6 feet, especially for construction workers and the general public. This is not pertaining to healthcare workers, which may have a different definition.
Thank you, Travis. Another question. Let me direct this towards Dr. Luckhaupt. What is the contagious period for COVID-19?
Hello. So based on the best evidence we have so far, about 10 days after developing symptoms is the longest that we expect most people to be able to transmit the disease. So that's why the recommendations for the discontinuation of isolation or return to work are based on 10 days after developing symptoms or having a positive test. Now, it is possible that for some cases that are particularly severe, such as those who are hospitalized, or among people who have compromised immune systems, they may shed the virus for longer. So in those cases, a healthcare provider should be consulted to determine when it's safe for them to get back into the swing of things and be exposed to people again.
Okay, thank you. And then another question, and I think this may have been touched on a bit, but is the employer, what's the employer's responsibility when it comes to contact tracing? Employer versus the health department?
I'll try to handle that one, and then Sarah, you can maybe jump in afterwards too.
Okay.
In my interpretation, it's like I just talked about. It's to cooperate with the health department and report, what you hear, and then track your workers on your job site and be part of the whole system, but not try to act as the healthcare provider and leave that up to the health department and agencies.
Thank you, Travis. Dr. Luckhaupt, do you want to add anything to that?
Yeah, I agree. I mean, as I mentioned, the authority for contact tracing lies with the public health departments, but because of the sheer volume of cases and contacts for COVID-19, it's really great if employers are able to help facilitate that process as much as they can, but they're not responsible for leading that process.
Okay, thank you. And then another question related sort of to the process. Is contact tracing, should it be done, via phone, email, or is it better to do it in person? How is it commonly done? You direct that to Travis in terms of his experience, please.
Yeah, I think that's all the above. I know a lot of the traditional contact tracing has been done over the phone and led, again, by the health departments or agencies. But at least in construction, on a live job site, you do have those other person, you need the people on the ground to determine what's going on and how to track people that are symptomatic or suspected or known cases. So I think it's all the above, and not just on the phone as traditionally done.
Yeah, I'd agree that that's probably one of the ways that employers can really facilitate too, is if they are on the ground and are able to speak in person to the workers who may have been exposed, because yes, the health departments typically rely on the phone, and especially, well, maybe not especially due to time and resources, but also to protect themselves as workers.
Okay, thank you. And then another question, I think was touched on a little bit, but the question is, please speak to the requirements from OSHA and other governmental organizations about sharing corporate contact tracing information. OSHA currently has no requirements, so it's sort of a statement as well as a question.
Yeah, I'll try to jump in on that one. They answered their own question up front by saying currently OSHA does not have a stance on contact tracing. I don't even think they mentioned it on the website. I was searching through it and trying to find something. But on the other hand, CDC does have a whole lot of guidelines. They are not enforceable currently right now. They're best practices and guidelines. So that would be where I would direct somebody that really wanted to dive in deep on contact tracing, is follow the CDC guidelines and then reach out to NIOSH folks and CDC. But they kind of answered their own question by saying no at first, and then I would just defer to CDC NIOSH.
And I would add to that really the information and guidance and recommendations from CDC and NIOSH are really just that, recommendations, and that the local and state jurisdictions are really the only ones that can make laws. And I have heard that recently several states have been considering legislation or other kinds of rulemaking that either mandate businesses and other establishments that wish to reopen to cooperate with health departments, or that restrict health departments from making it mandatory. So it's really important to try to keep up with what's going on in your local areas. And I found some of that information from the Association of State and Territorial Health Officers, so that might be a place to look.
Okay, thank you very much for that response, Travis and Dr. Luckhaupt. Here's one. This is a little bit different than the contact tracing specifically, but the question has to do with COVID-19 and whether it should be considered an occupational disease. I know there's a lot of complexities around that. So I don't know, Dr. Luckhaupt, if you would like to weigh in on that, or I think Travis as well could share his perspective.
Yeah, I can comment, but it's mostly to refer to OSHA guidance on this. So, yes, I mean, we believe because it can be acquired in the workplace, it can definitely be an occupational disease. But having said that, as acknowledged by OSHA, given the nature of the disease and the ubiquity of community spread, in many instances it remains difficult to determine whether an individual case is work-related, especially when an employee has experienced potential exposure both in and out of the workplace. So OSHA has released and is updated over time some enforcement guidance for recording cases as work-related, and they provide some guidance and some examples, such as that COVID-19 illnesses are likely work-related when several cases develop among workers who work closely together and there is no alternative explanation. So it has to do with both the likelihood that there was exposure at work and that there is not an alternative explanation.
Yeah, that's a very good answer, Sarah, on a tough question. OSHA does have the guidance there, and also if you're going to need to, you have to basically prove that it's work-related with objective data. It can't be just pure subjective because of the nature of the disease. The only population, and we're talking construction today, but it's a little different again in healthcare. But if you're outside of healthcare or not a medical worker, if you're on a construction site, it had to be because of something objective, such as an outbreak or known exposures of several people on the same job site, something like that. So very good answer, Sarah.
And I would just add that regardless of where an individual worker contracted the disease, it's still important to identify the case and prevent transmission within the workplace. So I think in general the health departments will not be trying that hard to make a determination of work-relatedness on individual cases, but their goal is really just to prevent the transmission of disease in additional cases.
Okay, thank you. And then we had some questions sort of related to the face coverings and respirators. I may weigh in on this, but Travis and Dr. Luckhaupt, you may want to as well. This is a question that came in through the chat. It says, do you feel the need to remove most facial hairstyles for face coverings? From my perspective, the issue of facial hair is primarily an issue with N95 respirators or higher levels of respiratory protection versus cloth face coverings because of the need to seal the N95 to the face, because when you're breathing in, this gets into the mechanism of how cloth face coverings work versus respiratory protection. With respiratory protection, they're designed to filter out the particles when it's breathed in, and so you don't want bypass around the perimeters of the mask. And that's one of the reasons why fit testing is required if you're wearing an N95 respirator that uses filter media. But with a cloth face covering, that's a source control where you're basically, it's intended to collect large particles when somebody sneezes or coughs or even is speaking. And so the whole mechanism and collection is different. So again, my response to that is that the issue of facial hair is much more of an important issue when you're wearing like an N95 respirator or something like that, where you need to make sure you have a very tight seal and all the air that's being breathed in goes through the filter. But I don't know if Travis or Dr. Luckhaupt, if either of you would like to comment on that, beyond what I said.
Yeah, Scott, I agree with what you said, and especially at the end, you nailed it when you talked about the fact that a face covering is source control, not filtering of the air you're breathing. You do get a little bit of filtration depending on the face covering. It's all over, from 60% to 5% protection, but the intent of wearing face covering is strictly for source control and not respiratory protection. So I think you answered that well, and it's not as important when it comes to source control as it does for a respirator.
And the other thing is it also ties into just the size of the particles we're talking about. Again, with respiratory media, you're talking about micron-sized particles, very small particles that can easily, follow the streamlines of the air and can leak in, as opposed to with cloth face coverings, you're talking about very large particles that are being, expelled and would basically collect on the mask through just the impaction, as opposed to diffusion or some of these other collection mechanisms for filter media. Okay, here's one. What does the CDC Public Health Law Program advise when a close contact of a confirmed COVID-19 case refuses to be tested or refuses to self-quarantine? So this is a tricky one. Yeah.
So I'll try my best at that one. First of all, it's not a law. The CDC does not make laws, so they make guidelines, or they submit guidelines that are recommendation and best practices. There is no law. OSHA makes laws, and there currently is no law. That's going to change in some states soon, but we're not there yet. My simple answer to this is if you have a combative employer, employee, or somebody on the job site that just will not listen to mandates made by the state or whoever local authority is, you call the local authorities. Again, just like you call on the health department as professionals, you call on the local authorities to come kind of help you with that combative person. That's the best I can answer that.
Okay, thank you, Travis. Let's see. Another question that we got through the registration was, what methods are used to extend the use of disposable respirators? And I could weigh in on this one as well. And there's a number of different things that CDC has done to help with this issue. One is to approve respirators from other countries, and there's actually a lot of information on NIOSH's website about various manufacturers from all over the world, and there's been some testing done to look at how effective they are. And this is really important to look at because, quite frankly, it's all over the map. There's certain respirators from China that have very high filtration efficiency and performance, and there's others that are just utterly terrible. And so, very low collection efficiencies and just not very effective. The other thing that's been done, there's been a fair amount of work done on decontaminating respirators so that they can be reused. And so some of the methods that are being used for that include use of ultraviolet germicidal radiation to decontaminate them, use of vaporous hydrogen peroxide, and moist heat. So there's a number of ways to decontaminate them and reuse them because of the emergency situations that we're dealing with. Although I would say that I think the issue with shortage of respirators is definitely improving, but there still could be some concerns as some of the numbers are going back up. But I'll see if either Travis or Dr. Luckhaupt would like to add anything more to that about extending the use.
Yeah, I would just add that there's a lot of information on the CDC website about strategies for optimizing the supply of N95 respirators that are kind of geared toward healthcare facilities but might be able to be applied in other contexts. And basically they categorize strategies into the conventional capacity strategies, which is what should have been being done before COVID, and then contingency capacity strategies and crisis strategies. And so some of the strategies, such as decontamination, may only be recommended when there's a crisis situation. And so I just refer people to look at the website to see which strategies would be preferred if you can get to those before you get to the crisis situation.
Okay, thank you. We're running short on time here. Let me just see if there's a few more questions that we could just touch on briefly. One question, I think this is probably more for Travis, has to do with use of tracking devices in construction, specifically on hard hats. Do you have any experience or knowledge of that and how that applies to the situations we're dealing with?
Yeah, there's absolutely all kinds of technologies going on, and whoever asked the question is absolutely correct. There is a device that you can put on a hard hat that will help track your workforce for contact tracing. And what I will say to that is this may be a very usable technology to help keep attendance, like I was talking about, keep track of different crews. You can assign different colors to different trades or different task-driven work that they're doing, different, subcontractors. So it could be a very good method. But I will emphasize, as I talked about, to keep worker protections in place and privacy protections in place. Just use it for tracking of your workforce. Don't use it in any other way besides to track your workforce.
Okay, thank you very much. And then just want to be respectful for everybody's time, but let me just ask one final question, and then we will wrap things up. Again, I think this is for Travis. Has to do with the wearing of gloves. Question is, I've observed that wearing gloves to do certain tasks can actually enhance contamination. do you have any thoughts or experiences related to the use of gloves and how that can create contamination issues?
This is true, what they've read. So glove use can be very effective as a barrier protection for any kind of virus, including COVID-19. The problem is cross-contamination and again, reuse of gloves. You're not supposed to. Gloves are intended to be disposed of immediately after being used, and there's some very specific training on how to deglove, how to put your gloves and take, decon your gloves. All that is very specific training for workers. So if you're talking about your average worker that hasn't been trained using and reusing gloves, that can absolutely be a problem with cross-contamination and recontamination. So I would encourage more use of hand washing and proper hand hygiene and cough etiquette over the use of gloves, unless you're on a specific site like a hazardous waste site where everybody has been trained on proper glove use, proper doffing and donning of gloves, proper disposal. There's a lot that goes into it. So when we're reacting to a crisis mode like epidemic like we are, a pandemic, I would just focus on hand hygiene and hand washing and not rely on gloves.
Okay, very good. Thank you very much. I want to thank both of our speakers, Dr. Sara Luckhaupt and Travis Parsons with the laborers. Really appreciate you sharing your knowledge of contact tracing. And with that, we'll go ahead and wrap it up. But I just want to wish everybody a good rest of your day and just thank everyone for your hard work in trying to prevent the spread of COVID in the construction industry. Thanks so much and take care.